Wel, Peter, diolch yn fawr I chi am y cyflwyniad caredig. Yna pleser mawr, wrth cwrs, I fi fod nôl man hyn yn Gaerfyrddin. Pan oeddwn ni'n ar y daith lawr o'r Caerdydd bore yma, oeddwn ni'n cofio pan oeddwn ni'n yn yr ysgol yma yn Gaerfyrddin, nôl yn y 70au, yn eistedd yna yn y naiad yma ac yn clywed bobl pwysig yn dod I Gaerfyrddin. Clywais I Tony Benn yma yn y naiad yma, clywais I Roy Jenkins a clywais I Harold Wilson pan oedd e'n prif weinidog yn dod I Gaerfyrddin ac yn siarad yma yn y naiad St Peters. So, pleser mawr I fi fod nôl yma a diolch yn fawr am y cyfle I siarad I chi gyd. Thank you very much indeed for the opportunity to be here and to talk to you on an agenda which I think is especially important for us here in Wales. I've been very fortunate that long before becoming a minister, I've been involved in the credit union movement in Wales. Many of you here will know Bill Hudson, and 25 years ago, Bill and I worked together on the Ely estate in Cardiff, helping to set up some of the very first of the new wave of credit unions, which back there in the 1990s were beginning to spread across the whole of South Wales initially, and then north too. And I see other people in the audience here who are part of that movement. And as a councillor, a local councillor in South Glamorgan at that time, we were able to set up an employees' credit union as part of the county council, which has been, in many ways, the bedrock of credit union activity in the capital city of Wales ever since. And as a member of a credit union and as someone who has researched and written in this field, it's a particular pleasure to be able to talk today on an agenda which brings together a whole series of key concerns. Now, you will hear during the morning of the new research that looks at the connection between health, mental health, and financial insecurity. And none of that, I'm sure, will come as a surprise to people in this room. The impact on mental well-being of the daily struggle to survive financially, and the oppressive nature of debt, where people feel that they simply cannot see a way out of a set of difficulties into which they have fallen, are intimately connected. But the connection between poverty and health goes beyond mental well-being. You will know that during the winter, health services in all parts of the United Kingdom always come under pressure. There is always greater demand, and that demand often finds itself into emergency departments. Now, over the winter of 2012-13, which was a very long, hard, prolonged winter, the longest, hardest winter for 50 years, those pressures were particularly felt in accident and emergency departments. And Public Health Wales, who you'll be hearing from as well today, did a piece of research for us, looking to explain what lay behind the pressures that the health service was facing. And Public Health Wales analysed the pressures and they rank them in order, and they find that absolutely, indeed, the long, cold winter had an impact of its own. They know that demography has an impact. We have an ageing population, and the average age of someone coming into an emergency department in Wales over that winter was 85. And we know that we face the consequences of changing patterns of social life, so that the 85-year-old person coming into an emergency department in Wales was most likely to be a woman, and most likely to be a woman living on her own. and living, in some ways, quite fragile lives. But when you've taken everything to do with demography, everything to do with the nature of that winter, and everything to do with social patterns into account, the single most important factor Public Health Wales believed that was bringing people through the door was the impact of poverty. The people who were coming in such large numbers into the health service over that winter genuinely are people facing choices between heating and eating, managing in very pressurized circumstances which tip into crisis at the point where those extra demands on those incredibly restricted budgets really begin to bite. So the connection between health, wealth, income, they are as close as you can imagine and really, really do make a difference. And they make a difference not simply in the lives of people who use the health service, but the age of austerity has a real impact on the lives of people who work in the health service as well. The health service is the largest employer in Wales. It employs 80,000 people in every community in the land. And many, many of those people work not in high-paid or glamorous occupations, but for relatively low wages. Wales has the highest proportion of any part of the United Kingdom of single-earner households, where that single earner is a woman. And that woman is very likely to be working in the health service. And the impact of austerity, of being the one person in your family who has a job, and having to sustain the whole of your family through that job, where that job is both demanding but is not financially hugely rewarding, has its impact on people who work in our services, as well as those people who rely on them. And here's why today's conference is so important, because it brings together a set of really important purposes where it is possible to help one another in a way which is completely to our mutual benefit. One of the very early pieces of serious research into the credit union movement in the United Kingdom, back in the 1980s, was carried out by a man called Richard Berthold. And he carried out a piece of research asking people what it was that the credit union movement could offer that was most attractive to them. And he interviewed a set of people who were living in very difficult financial circumstances, and he interviewed a set of people who were in employment and earning regular money. And he asked them whether it was the ability to borrow or the ability to save that they most valued from a credit union. And the results were, I thought, entirely counterintuitive. Because people who had very little said that what they really valued from the credit union was the opportunity it provided to save money. Because they couldn't find anywhere willing to take their money. Banks weren't interested in them. Even the post office required a minimum of £5 if you were going to take money in and save. But a credit union was interested in you even if you had just 50 pence that you could spare every week, and keen to have it from you and keen to do it in a way that suited your circumstances. And people who were in work and had money were interested in the credit union as a place to borrow money, because rates of interest from a credit union were so competitive compared to other places that they would be able to borrow. Now, what we need to do in Wales is to go on creating a credit union movement that is sustainable without the need for long-term subsidy from government, so that it can go on providing the services that only it provides to the most financially vulnerable in our communities. If it is going to be able to do that, it has to draw into membership a higher number of people who are in work and have money that they can put through the credit union in order to make it sustainable. And that's why right across the Welsh Government, all ministers are committed to increasing the flow of public sector workers into membership of the credit union movement here in Wales. And I, as the Health Minister, am very determined to do everything I can to make sure that our local health boards, the biggest employers normally in the areas in which they operate, do everything they can to bring the advantages of credit union membership to the attention of those people who work for them, and to make it as easy as possible through payroll deduction and other measures for those people to be members. And if we can increase the flow of people who work in our public services into credit union membership, we will have done them a service. And by the service that they then provide to the credit union, we will have allowed credit unions to go on providing a service to others. It really is a virtuous circle. It's one of those rare occasions in public policy where absolutely everybody benefits. So we need to do more to make it happen. And Jeff Cuthbert, as the Minister with the main responsibility for credit unions, has provided further sums of investment over the next 12 months to help in that job. And it will only happen through a combination of push and pull. And there are people around the hall today whose job it really is to be part of that process. It's great to see people here from Hywel Dda Health Board. It's great to know that there are people here from Ceredigion, Carmarthen and Pembrokeshire local authorities. And we have a job, those of us who are in those positions, to be doing the push, to be making sure that we do everything we need to do to bring the benefits of credit unions to the attention of people who work for our organisations, and to work hard to make sure that it's as easy as possible for them to become members. But equally in the hall, there are a whole group of people who are here from the credit union movement itself. And just as we have to push in public sector organisations, so you have to pull to make sure that you do what you can to pass that message, to provide the publicity, to give the practical demonstrations of what credit unions can do. There is such a great story to tell, and we don't tell it loud enough. Now, it's very good to know that in the new marketing effort that credit unions are making, there's a special subgroup looking at exactly the relationship between credit unions and the health service here in Wales. And what I really feel strongly the credit unions have to do is to put their weight, their enthusiasm, their expertise into that equation so that we get the synergy that's there to be had. And if we do that, as I say, we will have achieved something really important here in Wales. We will have done it to the advantage of people who work in our services. We will have done it to the advantage of credit unions. And by making the services that they provide sustainable into the future, we will be able to go on providing a service to those people who use our health services, for whom poverty is a defining characteristic in their lives and circumstances, whether that is physical or mental well-being. And it's a contribution which is just waiting to be harvested off the table. The next 12 months are going to be really important in this agenda, and today's conference is a really important part in making it happen. Diolch yn fawr iawn I chi gyd am y cyfle I siarad â chi bore yma a'r peth mor pwysig. Mae'r gwaith galed iddi ni I gyd I wneud, ond pan ni'n llwyddo I ni gyd hefyd. Enjoy the rest of the conference, and let's go from here today with a determination to do those things which every one of us can do to gather the benefits of this shared agenda for the people we all have such an important interest in promoting their welfare. Diolch yn fawr iawn I chi gyd.